All right, let's dive into a skill that's frankly non-negotiable for anyone in healthcare: calculating medication doses for kids. This isn't just about getting the math right. It's about safety, where even a single misplaced decimal point can change everything. So let's get into it.
You hear this phrase all the time in pediatrics, and there's a really good reason for it. A child's body is just fundamentally different. Their metabolism, how their organs are developing, their body composition, it's a whole different world. So just shrinking down an adult dose, that's not just wrong, it can be really dangerous. It calls for a totally different playbook.
And the stakes? They couldn't be higher. A simple mistake, using the wrong weight, putting a decimal in the wrong spot, can turn a medicine that's supposed to help into something harmful. In fact, dosing errors are one of the biggest causes of medication-related harm in children, which is exactly why we have to get this right.
So how do we make sure we get it right? Well, let's start with the basics, the foundational method. This is the standard playbook you'll be using most of the time.
The absolute cornerstone of pediatric dosing is a method called weight-based dosing. And it's pretty much exactly what it sounds like. The dose you give is based on how much the child weighs. This is ground zero for almost every calculation you're going to make. And here it is, the core formula. It looks simple enough, right? You take the dose rate, that's usually in milligrams per kilogram, and you just multiply it by the child's weight in kilograms. What you get is the total dose you need to give. Most of the time, it really is that straightforward.
Let's see this in action with a really common example: paracetamol. Okay, so the standard dose is 15 milligrams for every kilogram of body weight. And let's say our patient is a child who weighs 20 kilograms. We just multiply 15 by 20, and we get 300 milligrams. Simple, effective, done. But is it always this easy? Well, this is where things can get a little more complicated. Because in the real world, that simple little formula can sometimes hide a pretty serious danger, especially when a child's weight might not be telling you the whole story.
And this leads us to a really critical question, one that every single clinician has to ask. Is the child's actual body weight always the right number to be plugging into our formula? And as you've probably guessed, the answer is a big no.
Here's the problem. When a child is significantly overweight or obese, just blindly using their actual weight can lead to a massive overdose. And the reason is actually pretty simple. A lot of drugs don't really distribute into fat tissue. So you might be giving a dose for a 40-kilogram body, but the drug is only really working on the 30 kilograms of muscle and organs. That mismatch, that creates a huge risk for drug toxicity.
So for these specific situations, we need a better, more advanced tool. And this is where we introduce the idea of calculating lean body weight.
So what exactly is lean body weight? Think of it like this. It's an estimate of a person's weight if you could somehow just remove all their body fat. It's the mass of their muscles, their bones, their organs. And for a lot of medications, this is a much more accurate picture of the part of the body the drug is actually going to affect.
So when do you use it? Well, here's the simple, actionable rule of thumb to remember. If a child's actual weight is more than 20% above what their ideal weight should be for their height and age, that's your signal. That's when you should seriously consider using their lean body weight for the calculation instead.
To really understand just how much of a difference this can make, let's walk through a quick case study. You'll see the real-world impact of choosing the right weight.
Okay, so here's our patient, an 8-year-old, 130 centimeters tall, and weighs 40 kilograms. Now, their ideal weight should be closer to 30 kilos, so they are definitely over that 20% threshold we just talked about. We can use a formula to figure out their lean body weight, and it comes out to around 28 kilograms. So here's the crucial question. Do we dose amoxicillin for a 40-kilo child or a 28-kilo child?
Okay, so what if we made a mistake and used the actual weight of 40 kilograms? The math would give us a dose of 600 milligrams. Now let that sink in for a second. The maximum standard dose for a full-grown adult is 500 milligrams. We'd be giving a child a dose that's higher than what we'd give an adult. That's not just wrong, it's a dose that carries a serious risk of toxicity and could potentially harm their kidneys or liver.
Now, let's do it the right way. We use the lean body weight, 28 kilograms. The calculation now gives us 420 milligrams. Now that dose is safe, it's effective, it's well within the recommended limits. Just look at the difference between those two numbers. That right there is the power of using the right tool for the job.
So why does this rule even exist? Well, it's not arbitrary at all. It's all based on pharmacology, how drugs actually work in the body. As you can see here, it depends on the type of drug. Hydrophilic or water-loving drugs like amoxicillin, they mostly spread out in muscle and water, not in fat. So for them, lean body weight is the way to go. But then you have lipophilic or fat-loving drugs. They do get absorbed into fat tissue. So for those drugs, using the child's actual body weight might be the more appropriate choice. The key is, you've got to know your drugs.
Okay, so how do we wrap all of this up and put it into practice? Let's just boil it all down into a final safety checklist you can run through every single time. First, always use a current measured weight, no guessing. Second, assess that weight. Is it in a normal range? If not, think about that 20% rule and whether you should be using lean body weight. Third, and this is a great sanity check, never ever exceed the maximum adult dose. Fourth, be practical. Round your final dose to a volume that someone can actually measure accurately. And finally, the most important step of all, always double-check your work with a trusted resource before that medication goes anywhere.
Because at the end of the day, it really all comes down to this one simple, powerful truth. When you're caring for kids, there's just no room for error. Precision is safety. In pediatrics, every single milligram matters.